Hi, I'm Dr. Nikita Vizniak, and today I want to talk about disc herniations. But before I can talk about disc herniations, I have to tell a story of how I herniated my own disc and what I did to actually recover relatively quickly and share those results with you so you can see faster healing times with your own injuries. So first of all, we need to understand what a disc herniation is. Then I'll go through and tell my story, what actually happened, and then I'll show some of the rehab exercises and things that I did to actually get better from it. So to start with disc herniation, this is your low back. You're looking at an annulus fibrosis with this nucleus pulposus. It bulges out and it pushes onto a spinal nerve, and it results in exquisite low back pain and potentially numbness and tingling down your leg. Now, my story starts off 2 years ago when I was out on a family vacation camping at Porto Cove. And I decided I wanted to take a nice family picture, but the lighting was off a little bit. So what did I do? I decided that I'm going to pick up this one log and move it over. So this is an oceanfront campsite, beautiful campsite. It's before this picture was taken, actually about 3 minutes before this picture was taken. I decide I'm going to pick up this log. So I get set up, anchor down, go to lift up. I'm in a very flexed position. I go to pull and snap in my low back. And right away, I drop to my knees. I didn't actually herniate a disc at that time, but I had exquisite point tenderness. In this picture, I'm actually sitting up there and I'm just like, oh, this is not good. I could barely get myself up there. The next day, I couldn't even put on my socks. I couldn't even bend forward or anything like this because of the exquisite acute low back pain that I actually had. Now, the first couple days were pretty crappy. We're out camping. I'm just trying to move around, find any positions that can make it feel better. That's one of the key things you have to do. Find positions that make it feel better to start, and then start challenging those positions, okay? And I'm not joking about this. Like, it was bedridden, 9 out of 10 pain. I could barely move. I could barely do anything for the first day. Second day, a little bit better, but you still get those sharp jolts that actually just stabbing pain right into your low back. No symptoms in the leg. But what I suspect happened, what that snap actually was, the popping that I actually heard, could have been a cavitation, or it could have been a release or a sprain of the low back. And that's what facilitates a real disc herniation, is prior injuries. So if we look at the next stage, 2 years ago in April this year, what did I wind up doing? I wound up, oh, that's the wrong picture. I wound up doing stupid things like a lot of people do. And my stupid thing was moving around an 800-pound beam with my tractor. You can see my gorgeous little redhead right there, little cutie patootie. And then after I moved this big beam and had to drag it and pull it around and do all these actions with my back, I needed to move a bunch of pieces of granite. Well, look at my back position right here with these pieces of granite as I'm moving them around. I'm in a flexed position moving from side to side. They were lightweight, so I didn't think it was going to be an issue. Boy, was I wrong in this flexed position. So I'm bending forward, and the same thing again. Snap in my back, instant onset of pain, but this time it was different. The pain actually shot into my low back, into my groin. I almost felt like I was going to drop to my knees. I had to hold my breath. I couldn't move at all. The pain was so exquisite. The follow-up was me trying to get back into the tractor. So if you look at how I'm moving here, I am moving very slowly trying to get myself back into the tractor. It took me about 5 minutes to walk from the front of these forks back into the seat right there and find a position that felt a little bit better. If you look at what I'm actually doing, I am putting my hands and walking my way all the way back to a seat. Once I got into the seat, I had to sit there for 5 minutes again and just wait and be like, well, what can I do here? How am I going to facilitate what has actually happened, and what am I going to do for treatment? Same process as before. What happened? Low back pain, acute low back pain, shooting pain down my leg, positive straight leg raise. I made it a great case for all the classes that I teach so they could actually go in and do their assessments on me and see what real positive results look like. But I was better from this 9 out of 10 pain in about a week and a half. And the big thing that I want to share with you is, how did I do that? But before we can get there, we have to understand some key things about low back biomechanics. First thing that we have to realize is what actually a disc herniation is. We talked about that at the very start. You're getting a rupture of an annulus fibrosis, which is a ligament in your back, and you tear out this nucleus pulposus into it, and it compresses onto a nerve. A big finding, which I had following the tractor incident, was coughing, sneezing, straining make it feel worse. All right? And what a lot of people do when they get this acute pain is they stop challenging it. They're so fearful and scared of it, they won't go back and challenge it again. You absolutely, positively have to challenge the movements again. A couple of positive tests that you would have for. We've already covered this, but just make sure we've got it. We want to make sure that if the pain is worse with coughing, sneezing, or straining, happened with a lifting, twisting event, had a prior disc herniation, positive straight leg raise test, loss of deep tendon reflexes, muscle weakness. These are all findings associated with disc herniation. You actually do not need an MRI to confirm the presence of a disc herniation. Look at the presenting symptoms and you can figure it out pretty quickly. And this was me right here if you're looking at it. So this is actually going to be an MRI at the top. So if we look at this, we can see what a beautiful disc should look like. This is a water-filled disc, fantastic. This is a disc that is starting to herniate. It still has a little bit of its nucleus pulposus and good water integrity. And this is a degenerated disc right here where we see less water, loss of joint height. This is a pretty common thing we see in a lot of low backs given our bipedal motion that we do. And this is just a transverse section through showing you the same thing where we have a little bit of a disc bulge as well. Again, may or may not correlate with symptoms, but if you have all the previous ones that I mentioned, you can directly correlate it. Our goal is always treat the patient, not the pictures. So now we go into what can you do about it? Well, you've got to realize some basics for mechanics. The first thing is laying down is one of your best treatments for low back injuries. It takes tension off the discs, off the muscles of the low back, off all the ligaments and joint capsules and joint surfaces themselves, and relaxes your back. And in fact, what you actually do is you pull fluid back into those structures when you're laying down. Standing up, you're going to modify and move in different positions, rocking back, rocking forward to see what makes you feel better. The key thing that you want to absolutely avoid though is these slouching positions, okay? If you sit in a chair and slouch, the pressure in your disc is up about 185%. That's crazy pressure increases. Your body is designed to do that when you're healthy, but when you're in pain or you have an injury, it can cause significant pain. The same thing when you're doing a deadlift. Now I treat a lot of bodybuilder type athletes, and almost to a person, they have wrecked their back from doing some type of deadlift. And it's almost always poor form, rounded back, the weight is far away from the body. That's what you're trying to avoid, is that type of a position. How did I actually herniate my own disc? Being an idiot doing that exact same thing. I'm bending forward, tossing pieces of granite all the way forward in that position. That is a guaranteed way to hurt your back. And I'm speaking from experience from thousands of patients and my own body. So hopefully we can understand that process a little bit better. Next thing we can see is how you're going to fix it. So I'm just going to move the camera here a second and talk about that. Okay, so you want to look at a couple of ways that you're actually going to heal your back. So the last herniation that I suffered, when was I deadlifting? I was deadlifting within a week and a half. That deadlift was ultra light. I only had 25 pounds on the end of a bar, but it was still enough to start to load the tissue. And get this, you have to load a tissue to heal a tissue. If you don't load it, it's not going to get better. The very starting point is an exploration of space that causes pain or relieves pain. So you can tilt your hips back and forward and maybe see what kind of bias and movement you have. Some of you out there are going to be better with flexion type movements. When you hunch forward like this, you're going to say, yep, that makes it feel better. Some of you are going to feel better with extension type movements. Whatever it is, you want to find your bias and start with those actions. So if you feel better with flexion type movements, these are the best examples. If you go on YouTube and type in Vizniak disc herniation, I have a number of videos up there. I've got one patient who had to sleep. She had to sleep in child's pose to decompress her back. For me, my starting point was something as simple as just laying down and taking my legs and rolling them from side to side. So I rolled them from side to side to see where I had pain and discomfort. These movements may seem ultra simple. Trust me, when you're in acute low back pain, this is going to tell you exactly where you want to move. Okay? Next action is going to be something as simple as a leg lift. One leg comes up, how do you do with that? Other leg comes up, how do you move with that? Even putting your legs straight. And again, you're just exploring, looking for ranges. The opposite action is going to be, if you have better movement or a decreased pain with extension, switch over to these extension type exercises. This glute bridge I might do a little bit later, but you can go ahead and start off with something as simple as a cat-cow or a Sphinx pose. And yes, these are yoga poses, but a couple of key things that you have to get with this is you want to move your spine in an unloaded position. So something as simple as this, being over like that. I'm actually just pop this off for a second because I'm getting too hot. Okay, something as simple as this, knees over top of hips, okay, or underneath hips, and you're just in this position, just arching your back and forth, exploring ranges that make you feel better. Every time that you move your body, you are taking fluid and moving in and out of that disc, you're stimulating nerves in the area, you are starting the healing process. When you don't move, that's when you actually wind up delaying this process. On every patient, it's individualized what works, what doesn't work for them, and you have to find out your specific pattern and how that's going to facilitate your optimal healing. But hopefully you find this video useful. I can speak from experience in my own body and thousands of patients. We know what works, and for everybody, it is a little bit different. I've got one cyclist right now. Zolst, if you're watching this is you, okay? He came in, we went through all of our activities, and he said, you know what makes my back feel better? He just went into a little flexion like this and pushed back. Yet if he flexes down like that, it feels worse. So he's doing a micro movement just to stretch in just that little bit. Another patient, she's got a lumbar disc. She feels better back into extension. She can't get enough of positions like this, where she's into this low position here, or even pushing herself a little bit higher up right now. But the key thing is unloaded spine, challenging movements, trying to find positions that you can move and make your back better, and don't be scared to load it. Load it a little bit in a safe way, and you're going to see better healing outcomes. All of the research supports this. The sooner you load a tissue, the better off the healing is going to be, as long as you don't excessively load it. Hope you found this useful, and I'll thank you very much for your time, and check out some of our other videos, our books, and online content. Cheers.